Hi, Dr. Keener. My name is Carrie Jones, and this is the implementation to the agency for my simulation project for my practicum. So the objective is the nursing skills for training, the expenses, and the frequency of the training, as well as policies, procedures, integration into the community, and benefits of low validity mannequin. So, or simulation, they use a low validity mannequin. That's all that this particular clinic that I did my practicum in needs. So, we're looking at funding, which, in speaking to the stakeholders, funding was one of the big issues and setbacks that they only deal with one funder, which is Ontario Health at Home. And here in Canada, in Ontario, um, speaking Toronto, um, Ontario Health at Home is a government funded agency that delivers funding to all healthcare agencies within the surrounding GTA. And different Ontario Health at Homes um, offices allocate funds according to the needs of that specific community, which makes sense. But there are different grants out there. The nursing skills. So simulation is to target exercises, essentially some of the issues that the agency nurses were having or didn't lack that lacked confidence in certain skills, which was IV wound care. Specifically, because a lot of, when I talk about wound care, a lot of the referrals came in very vague from different physicians, and not always noticing the level of staging. So I used a foot that was used for 5 levels of wound care as well as for filament testing, which was the third skill that I targeted. So the cost to implement is anywhere from 1,000 to 1,000 to 5,000, sorry, per unit, depending on what you're getting. Equipment, supplies, dressing, syringe, gloves, stuff like that can it range from 500 to 1,500 annually, specifically for the simulation. A space, there is designated spaces that they do have at this clinic. Training so lead sessions, you can hire a facilitator for this, which will cost 50 to 100 per hour. But there is Samantha, which is one of the stakeholders. She can do it, but she needs to be trained. So she would have to take a course actually in this, and then maintenance of the equipment as well, right? So we also discussed the frequency of training. So initial training, nurses may lack confidence in these skills. So training ongoing. And she could also put out a survey to see where nurses are at, where their confidence is at, where their skill levels are at, and kind of base a training session off of that. So critical updates, so additional sessions may, need to be scheduled depending on if it's a novice nurse or not. If there are skills extending simulation out to the community nurses that are going home to home in different offices, not just, wound care IV or filament testing, but ostomies. I remember one of the nurses that came in for our workshop for IV, she did mention, ostomy. She's not very strong in that skill. So different nursing skills, catheters, aseptic techniques, things like that could all be used in simulation, creating a scenario and then using one of the mannequins if they get a low validity mannequin. So policies and procedures around that. So standard operating procedures with closing the gap, providing. So you have a tendency to provide clear and proper instructions on how simulation works. So I did that in the beginning, where I had what is simulation, and I had nurse managers, the stakeholders, as well as therapy managers come out, and I also created a YouTube link like I'm doing now. Um, to just educate individuals on what simulation is. So, competency validation, nurses will have to demonstrate proficiency on these skills once they go through simulation with a scenario. Incident follow-ups, use simulation post-incident to address the gaps. So, the goal is to address the gaps from theory to practice. And then, how confident are they building their confidence? So, are we going into pre-simulation with, like, say, 85% that they're not confident, and then after simulation, how confident are they? So integrating into, home care practices. So with the agency that I worked with, so real life scenarios, I created three of them, interdisciplinary teams, you know, nurses could also talk to physicians, other nurses, social workers, just a group that surrounds this patient and who's involved in patient care, and of course, documentation, so that there's a sequence of how documentation is done, easy to recognize, and nurses can follow that same sequence and document accordingly so that nothing's missed. Cost efficiency, affordable for what's affordable for this clinic, skill reinforcement for the nurses in the clinic and also outside. We're extending it and reducing risks. So we're using the mannequins, um, simulation scenario, simulation to practice, and then reducing the risk to the patients in the long run. Funding. So these are some of the funders that I did my research on. So CanSlim, they offer grants that aim at training nurses within a community setting, grants and fundings from Government of Canada. Ontario Health at Home is one of the fundings, but is also allocating different types of training methods that include simulations. So that hasn't launched yet, but that's one of the things that going forward they can also, the agency can check into. Samantha, one of the stakeholders that I worked with, she's going to follow up with that. So government grants and initiatives. So there are grants and initiatives and partnerships out there for, agencies such as the one that I did my practicum in. There's institutional funding and sponsorships, grants for simulation development, partnership and collaboration. So there is a lot of things that the agency can look forward to. Now that my practicum is done and Samantha has this information. So I just want to take the time to thank you for viewing my video on my link on implementation for my practicum project. Thank you, Dr. Keeter.